Our core mission is to take care of America's sons and daughters. And when we talk about taking care of America's sons and daughters, it's really about what the Chief of Staff of the Army has talked about, that trust is the bedrock of our profession. In 26 years as an Army nurse, I believe the most important initiative that we've put in place is the patient CaringTouch system. It truly now has given us a foundation and a structure to provide quality, safe patient care, at the same time enabling our healthcare team to feel valued and to have a voice in empowering the patient.
When I think about patient CaringTouch system, I think about the words patient, I think about the words caring, and I think about the word touch. Those are very intimate words, and although I serve in the Warrior Clinic, where we serve all armed forces of the United States of America, I am also a patient because I wear this uniform.
I see the role of the nurse as a patient advocate. This system and every aspect of it reinforces that.
Our patients now feel like they have a voice in their care. They're able to set goals that they can communicate to their healthcare team, where they feel like they're empowered for their care, that they're not just a number or a patient in room 127, that they're actually contributing to their health care, that they have control over their health care, and that their team is listening to them.
What inspires me the most about the patient CaringTouch system is that it's created a responsibility not only to our patients but to ourselves.
And to value all people, no matter what your rank or your grade is so important, because it truly takes the healthcare team to provide care. And it's building that trust not only with the patient, but building the trust with each other that is critical in all we do. We had a LPN at one medical treatment facility who said to us, I really thought that I would lose my identity, my scope of practice would be compromised by the patient CaringTouch system. But he later reported back it was entirely a different story. He felt he was now empowered, that he had more of a voice, and he had more of a say of what went on in his patient's care.
As a manager, it's enabled me to be able to bring in my nurses, help them to be able to achieve higher goals, working at the top of their license, and being able to bring in evidence-based practice into everything that we do.
I serve on the Unit Practice Council and the Nurse Practice Council, which means as a part of the team, I get a chance to have a voice and to say what works with patient CaringTouch, what doesn't work, and what we can do to make it better.
I think one of the most significant areas that we have seen an improvement with the patient CaringTouch system is when we talk about pain control and pain management. I believe also with what we've been able to do with the reduction of falls, medication errors, when you look at how our patients are able to communicate with us, we can never say mission accomplished with the patient CaringTouch system. It is really a living, breathing process, and that's how we have to look at it. We owe it to ourselves, we owe it to our patients, and we owe it to our teammates to constantly look at how we can improve the patient CaringTouch system. What we need to focus on now is sustaining this, and that is through constant improvement and to make it truly a cultural change, because that's what it is. And at the end of the day, it's about taking care of America's sons and daughters. It's about doing the right thing for our patients. It's about trust. That is what patient CaringTouch system is about. And it's the normal, natural, acceptable thing we should be doing, not because someone told us to do it, because it's the right thing to do.